Well, I've always aspired to what I call higher ambition leadership. A CEO is supposed to create economic value for shareholders, their employees, and their customers. But I've always wanted to take it to a higher level. And what that means is a CEO really has a moral and ethical responsibility to create social value in the communities in which we live and work. And so we've supported the American Cancer Society for over 20 years, and now I've stepped up to the plate to chair the CEOs Against Cancer, and I'm confident we're going to make a great difference. I never aspired to be a CEO, and I always said to myself, if I ever do reach the CEO level, then it'll probably be despite my leadership weaknesses, but then I'm going to endeavor to make a difference. And so when I became a CEO, I got the idea to do something really different. And so I've been a CEO for 23 years. To this day, I'm still the only CEO that I know of that I've ever met, and I've met many, many CEOs, who requires himself and every one of his senior team members to lead a major charitable event and participate on charitable boards. So in addition to American Cancer Society, we also support 43 other different charitable organizations. And it isn't just to help the charitable organizations, it's also part of the executive development of our senior team as well. And I think it all comes back to you in spades. As a CEO, I look at cancer as a continuum. And so it starts with the research, and it starts with prevention. And prevention encapsulates a number of different areas. So it's diet, it's exercise, it's genetics, and frankly, it's education. And when we look at if we can get people screened who are at risk and do that earlier, then of course we can make a great difference in terms of the outcomes of those patients, because then we're going to have earlier diagnosis. Earlier diagnosis is going to lead to more treatment options and frankly better outcomes and survival rates. I think every CEO wants to make a difference, they just may not know how to. Healthcare CEOs probably have a better idea of what they can do with their particular organization in terms of actively funding or doing in-kind giving or frankly addressing social determinants of health. But I think all CEOs in all industries can really make a difference. They can make a difference for all the employees in their company. They can influence others to help the American Cancer Society. So there's a whole continuum of things that CEOs can do because they're influential, and that's what I want to try to make happen with the CEOs Against Cancer. Everyone is completely on board in our senior team and making a difference for American Cancer Society and supporting me as the chair for the CEOs Against Cancer. And you know me well enough to know that I'm determined to make a difference. So it's all about mobilizing the resources and getting buy-in from the CEOs and getting traction that's measurable and tangible to show that we're really making a difference for people and outcomes of cancer.